Hunger doesn't just take a physical toll on people, there is also a mental toll as well.
Mental health expert Dr. Sheryl Ziegler, we want to bring you in now. And we know food insecurity, it's not just about having an empty belly. I mean, this affects every aspect of our lives.
It really does. And, to be clear, to be food insecure doesn't necessarily even mean you're in extreme poverty. It just means you have limited or lack of access to healthy foods and the availability to get them readily. And so you're right, it affects learning, it affects memory, it affects physical health clearly, and it affects your mental health. We know that kids who are food insecure have a greater likelihood to be depressed, anxious, even have substance use disorder. And so it really has immediate, outcomes, but also the long-term outcomes as well are really quite concerning.
We talk so much about schools providing breakfast in some cases and what difference it makes for teachers and others in the classroom and the kids and lunch. But also then I've also heard that sometimes long-term, if there's food insecurity, eating disorders.
Yeah. It's really interesting because in general, you can say stress increases. Right. And so within the whole family system, the stress goes up. And so and if you have a predisposition potentially to an eating disorder or to anxiety, there's even studies that say increased suicidal thoughts, even when all other factors were taken away, there were still these strong mental health outcomes. People really need to understand when you start as young as they say about 5 is when a kid would notice, we don't always have consistent meals, or parents look to be stressed to get us meals. So because they have behavioral problems at school, it starts leading them down a different track. So you're more likely to have behavioral problems. Then you get pigeonholed. Then if you have ADHD as a diagnosis, then those symptoms get exacerbated. And so you can really see how it starts to pile up on itself. So I can't emphasize enough the importance of 1 in 12 kids right now are food insecure. That's crazy. So I can't emphasize whatever we can do to destigmatize people trying to reach out, get food, to be able to have really supportive schools that, some schools have those backpack programs. They take a whole backpack on Fridays. Whatever we can do as a community to really wrap around and make sure every family, it's not just about the kids, the whole family really has food. It impacts nearly every domain of development for kids and eventually kids who will become adults in our future.
And we're doing, 9 Cares Colorado Shares now. We're asking everybody to come out and volunteer and donate and all those things. I think there's some people who think, well, it was really bad during the pandemic, but things are better now, right? I mean, food security isn't a huge concern anymore, but that's just not true.
It's not true at all. And if you look at the stats, we are where we were in 2019 today. So, but what that looks like is 2020, 2021 were years where we were at a record low poverty and food insecurity at 5%. But now things are going up. So now we have 12% of kids that are living in poverty. We have this, the 1 million families. Well, the 1 million families that are now living in homes that are food insecure are because they were benefiting from the programs that were put into place during the pandemic. And they're taken away. And if we don't have a plan, we just are going to see this continuing to perpetuate. And again, we are talking about immediate and long-term consequences on nearly every level. We didn't even talk about physical health, but chronic disease also goes up when you have food insecurity as a kid. So it's like almost nothing else in terms of affecting nearly every domain of development.
And we also have to take away that idea that it's okay to ask for help.
Yes, absolutely.
That's super important too, because I think that's also implied. Kids see mom, dad maybe don't want to, or that stigma of having to ask for the free meal.
Absolutely. And one of the things about asking for help is that when a family maybe gets to the point where they think we need to go to the government, we need to go somewhere and ask for help, there's also a fear, particularly around disadvantaged communities, that you'll take my kids away, or you're going to investigate me for child abuse because I'm going to tell you that last night I couldn't feed my family dinner. Jeez. So when you have, systems that maybe don't feel like they actually are there to protect you, but there's a risk, whether it's true or not, there's a feeling of this is a risk and I'd rather figure this out than tell somebody because I don't want my kids taken away. This is where we also have to really look at a systems level of this. How do we give really different messages around food insecurity versus actual child abuse, and making sure that trickles down to the communities so that they do go to the systems that are there to help them?
Okay, well, thank you. Just shine a light on all aspects of this, and we know so many people are going to donate anyway, and we appreciate it, and we just hope for better days ahead for so many of these folks.
Absolutely. We have to do better.
Thank you, Dr. Ziegler.
Thank you.